Are low iron levels the reason you're losing so much hair? Iron deficiency is the most common nutritional deficiency worldwide. There's an association between low levels of the storage form of iron, ferritin, with certain types of hair loss disorders, namely something called telogen effluvium, characterized by excessive shedding of the hair. It's normal to lose approximately 100 to 200 hairs per day, but if you have telogen effluvium, you are shedding way more than that. Your hair growth follows a cycle. There's a growing phase of the hair cycle, there's a resting phase, and a shedding phase. Whenever the body is exposed to significant stress, can be emotional stress or a nutritional deficiency, many of the hair follicles on your head are going to take one for the team, so to speak, and say, hey, we need to go into rest and conserve mode, and rather than use resources to grow hair, let's just shift things around and shed. And that's why you get a telogen effluvium. Why might low iron levels precipitate this? Iron is essential for so many different processes throughout the body. Iron is essential for building the oxygen transporting protein in our blood cells, hemoglobin. Without good iron, you can't transport oxygen around to the tissues properly, including the hair follicle. It also is essential for delivering key micronutrients to the hair follicle. Iron is also an essential component of the function of a variety of different important enzymes necessary to build your hair, to grow hair, including those responsible for replicating the DNA of hair cells. Iron also plays a pivotal role in the formation of keratin, the protein that constitutes our hair strands. When you have low iron levels affecting your hair, not only might you experience excessive hair shedding, but the strands themselves are likely to be brittle and prone to breakage. So in addition to hair coming out of the scalp excessively above and beyond what is considered normal, you're also going to be losing hair through breakage. So you might have little broken off hairs along with those clumps coming out. Before you go running out to the health food store to buy iron supplements, there are so many different types of hair loss disorders out there, each with their own underlying causes and factors that are playing a role. So first and foremost, it's very important that you get an accurate diagnosis of what your hair loss disorder actually is. I cannot stress this enough. When it comes to low iron levels playing a role in hair loss, primarily appears to play a role, namely, like I said, in telogen effluvium. There are a few studies here and there that suggest perhaps, although there's conflicting evidence, perhaps low iron levels may play a role in some other hair loss disorders that are non-scarring, such as alopecia areata, an autoimmune type of hair loss, or androgenetic alopecia, a type of hair loss that's quite common that relates to both our genetics and androgen hormones, leading to miniaturization, not shedding, miniaturization of the hair follicle. But really where we see it show up the most is essentially causing a telogen effluvium. Telogen effluvium is excessive hair shedding. It's a non-scarring type of hair loss. So while you may be struggling with it right now, there's hope that if you intervene, the hair will regrow. There's no scar there. It's not going to scar the follicle. If you haven't given a diagnosis of telogen effluvium, your doctor may order some blood work. They may identify that you have a low ferritin level. That's a sign that you have low iron stores. But that may not be the full picture explaining why you have telogen effluvium. There may be other things going on, other stresses that your body has gone through. Why do so many people have iron deficiency, low iron levels? Well, many of the people who have low iron levels are women of childbearing age. Women of childbearing age are in a period of their life where they lose a lot of blood. Blood loss is a reason to consider why you might have low iron levels. Blood loss through a monthly menstrual cycle. Those menstrual cycles are really heavy in the blood flow. That's quite a bit of iron being lost. Women of childbearing age may elect to bear a child. If they do that, guess what? They're going to lose blood. Losing blood through childbirth as well as losing blood through a monthly menstrual cycle adds up, okay? Adds up, making it much more likely for a woman of childbearing age to have low iron levels. Low iron levels might also be caused by other reasons to have blood loss. In older adults in particular, one concerning reason for blood loss is loss from the digestive tract, such as from a colon cancer. So that needs to be evaluated. Or maybe you have an underlying inflammatory bowel disease where you are losing blood from the digestive tract. That would need to be evaluated. You can also lose blood through the genitourinary tract. If you're having inflammation in your kidney, you're you're having urinary tract infections that are bloody, you can lose blood through the respiratory system. Did you have a surgery recently? If you had a surgery, there's a good chance you lost some, if not a significant amount of blood. Some people willingly give up their blood for good reasons, aka they donate blood. But frequent blood donations may be contributing to low iron levels. Aside from these reasons why you might be losing iron through blood loss, you also can have problems absorbing iron from your diet. Maybe you're simply not eating enough iron-rich foods, inadequate intake, but maybe your body does not absorb iron properly. Maybe you're taking a medication that gets in the way of optimal iron absorption, such as an antacid. Maybe you have had a surgical resection of part of your digestive tract, impacting optimal absorption. Absorption of iron can go down in the setting of either acute or chronic inflammatory disease processes. So maybe you have an underlying autoimmune inflammatory condition. Maybe that limits your absorption of iron. The third category of reasons why you might have low iron boils down to increase in demand. Nothing is more demanding of increase in iron needs than growing a child. So if you're pregnant, that requires a lot more iron than a non-pregnant woman. That's why a lot of prenatal vitamins have iron in them. So remember, pregnancy, increased demand for iron, and then delivery, you lose a lot of blood. So that's a reason why a woman might be dealing with low iron levels that are hard to get on top of, frankly. That coupled with the return of the menstrual cycle, and guess what also increases demand for iron? Lactation, breastfeeding. Rapid growth, such as a growth spurt during childhood, also increases the need for iron. But today's video, we're focusing on adults. So not only is it essential that you work with your dermatologist to nail down what type of hair loss disorder you actually have, if it comes up that at least some part of your hair loss is related to low iron levels, well then the question becomes, why do you have low iron? That's the next most important thing to address before you go running to the health food store to take iron supplements. Because as you can imagine, if you have low iron due to blood loss, you can pound all of the iron supplements that you want and it's not going to help. You're losing blood. That's the most important thing that needs to be corrected. What are some signs and symptoms above and beyond hair shedding and hair brittleness that you have low iron? Well, you might have anemia, but not everyone with low iron has anemia. So you can have iron deficiency and you can have iron deficiency with anemia. People with iron deficiency often will have what's called pallor, meaning they look a lot paler than they normally do. And this is especially noteworthy when you look at the conjunctiva of their eyes. They are pale. Sometimes the lips can become swollen, fissured, chapped, if you will, and prone to bleeding. You might also have a swollen, painful tongue. If you have iron deficiency with anemia, you may also be experiencing an increase in your heart rate and low blood pressure. You may find that you have difficulty concentrating. Many people describe symptoms of brain fog, memory problems. A lot of people develop what's called restless leg syndrome when they have iron deficiency. And if you take a look at your nails, you may have brittle nails as well as spoon nails. Spoon nails, otherwise known as koilonychia, are just what they sound like. Your nails curve up on the sides. There's a little depression in the center of the nail plate. You can put a drop of water on your nail and it'll stay there. It won't roll off because it's like a little spoon. So while these other signs and symptoms may be going on and may be helpful, keep in mind, a lot of people who have iron deficiency and iron deficiency with anemia have no signs and symptoms. They are asymptomatic. They feel fine. So if you've been found to have low iron levels, whether or not you're losing hair or not, what can you do? If you're having low iron levels that are not related to a problem absorbing it, you might try modifying your diet to include more iron-rich foods. Food sources of iron include lean meats, fish, such as sardines, legumes, nuts, seeds, leafy greens. Eating these foods with foods rich in vitamin C can enhance the absorption of iron. Tannins found in coffee and tea actually can lower absorption of iron from your diet. So it's suggested to wait at least an hour to 2 hours after eating a meal before consuming coffee or tea so as to limit this issue with reducing absorption. The calcium in dairy products also can reduce iron absorption. So make sure you're not eating all of your iron-rich foods along with dairy. And like I said, over-the-counter antacids also can reduce iron absorption. So you may need to make some diet and lifestyle modifications to help improve your iron status. Should you take an iron supplement? That's best to clarify with your healthcare provider. Some people will need to take an iron supplement, whereas whereas for others, it will be not helpful. If someone is recommended to take an iron supplement because they have low iron, well then the doctor needs to monitor their iron status, because you can get too much iron from an iron supplement and develop what's called iron overload, which, as a side note, I have a whole video on warning signs of iron overload not to miss, so check that one out if you're someone who is taking iron supplements. Remember, if you have low iron levels, it's very important to address any underlying root cause, such as gastrointestinal blood loss, inadequate consumption, inadequate absorption. That's going to be individualized to you, and most of these reasons, their treatments, are really outside of my expertise. All right, so say you're treating the low iron levels. Does that mean that your hair is going to come back to good hair growth? Here's where it gets even more confusing and annoying. In some cases, yes. Now keep in mind, hair does not grow overnight. It's a process that's going to take months to restore the iron and months for the hair to resume normal hair growth. So you have to be patient. Treating the low iron levels does not always result in correction of the telogen effluvium. Again, like I suggested at the beginning of the video, that's really why it's important to consider all possible reasons why you might be having telogen effluvium. For example, in the past year, did you deliver a baby? Pregnancy, delivering a baby, breastfeeding, all of these hormonal changes can lead to a telogen effluvium. So you may have multiple hits, so to speak, shifting things around. And those people in particular who have multiple kind of hits, if you will, factors that push follicles to the telogen phase, their hair is going to take a lot longer to go back to baseline. If you're continuing to lose blood from your digestive tract and you don't address that, that can actually turn life-threatening. You can develop a profound anemia, cardiovascular complications. It can get quite serious quite fast. And in some cases, while you may have an iron deficiency anemia, do you have any other underlying nutritional deficiency? I know how frustrating it can be to be dealing with excessive hair shedding or hair loss disorder. I really hope this video was helpful in clarifying the role that iron plays in healthy hair growth. Now on the end slate, I'm going to put my recent video all about the warning signs of copper deficiency and how that might be impacting your hair as well. So check that one out next if you missed it. But if you guys liked this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye!